And we're reporting, I believe, yeah. So, good morning. And today is Constitution Day. And I am going to be posting if you're old like me, you'll remember Schoolhouse Rocks. And I'm going to be posting a little cartoon about the Constitution from them. And I'm also going to be putting in two documents that, I advise taking a look at and knowing, it's important that we know our constitutional rights, that we're aware of them, and especially now more than ever, um, that we as Americans exercise our right to vote, our right to free speech, and all of that's in the Constitution. And so take a look. I'm going to post it to teens. And if you like, you can leave a comment and let me know what you thought about it. But as for right now, we're going to get started. And we're going to talk about, can you see my screen? It says kidney stones.
Yes, we see it.
All right. Okay. So, kidney stone. And let's go back and let's see, dust off the medical terminology. Does anyone remember what we used for the word stone? What's the medical term? It's Jeopardy. No, nobody.
I don't know if I'm saying it right. Lit, lit.
Yes, you are saying it right. Woo! Woo, woo. That's right. Very good. And so that's it. That was the terminology when we used for something as for stone. Now that's going to come into play today when we talk about kidney stones. And another name that you might hear him referred to is renal calculi. And that just sounds devious. And well, actually, kidney stones are pretty devious. Kidney stones are solid, okay? And they can be the size of a speck of um, sand or smaller, all the way to the size of a golf ball. Now, here's where the problem lies. Our ureters, which we know carry the urine from the kidneys and deliver it to the bladder. Well, our ureters are only 6 millimeters, which is pretty tiny in diameter. So carrying tinkle, that's not a problem. But carrying something the size of a golf ball is going to be a serious issue. That's not going to pass. That's going to be like the Lord of the Rings, you shall not pass. And well, they're going to have a big issue. And I can tell you from personal experience, I've been very fortunate. I've passed a couple of stones, but they were what they call sand. So it was painful, but it wasn't anything that it was just unbearable. Now, my poor husband, he has the unfortunate, something we'll talk about one of the reasons and causes, the unfortunate because he's a vampire and he can't get out into sunlight. So he doesn't go outside and soak up the beautiful sun rays and the vitamin D. So his body is deficient on vitamin D. And so that causes his body to go, hey, and turn on all kinds of switches to make calcium activate. Well, boy, the side effect is that's coming from the bones and it doesn't know when to shut off. And the bones begin to get weak over time, and the calcium blood levels begin to build. And guess what he makes? A kidney stone. So now we keep him on vitamin D supplements because he's still not going to class. So what our most common thing we see kidney stones being made from in the body is calcium. And it not necessarily has to be because of his reason. There's other reasons as well. But the most common, so write that down. The most common kidney stone is a calcium stone. Now, there are others. The second most common is what we call uric acid. Now, if y'all go back and remember our bones and our joints, remember gout? Now, gout was those tiny little crystals that formed in the joints, and I told you they were real painful because it was like a sedimentary, crystally buildup right in the joint where it bends, and it's painful. Well, uric acid is the cause of gout, but uric acid could also be one of the causes of kidney stones. So those are the two most common. Now, if we have, maybe we make a stone and it's so small that we pass it, we may not even know. The problem becomes when we start having stones that are larger or big enough to we can feel them when they pass. Because I'm going to show you, and let me know if you can see my screen. Do you see my little Google?
Yes.
Okay, good. I'm going to show you a picture of a kidney stone. So I'd like you to look at this. And do you see the jagged, sharp edges on it? That's going to be extremely painful. Even this, right? And these are showing you the different types and the different sizes, right? And actually, kidney stones can become, multiple. I don't know if that's real. That looks like a real kid. Jesus, Jiminy Christ, if it was. I don't know. I'd have to. Nah, I don't think that's real. But this is most definitely real. And so what ends up happening, let's take a look here. So our kidney produces this excess calcium, and we know that if it's excessive, we're going to get rid of it, the waste, right? So if this area was pretty large, that's the renal pelvis, right? And it can continue to build up the calcium or whatever it is, that sediment, and it gets larger and larger. And when it tries to pass, sometimes it never can pass through and it blocks. And this can cause serious medical concern because the kidney starts backing up and can become toxic in the easy way to explain it. Now, sometimes it's small enough because this is somewhat flexible, the ureters, but it's when it does, if it is capable of moving down through the ureters, you can see the tightness right here. And what that's going to do is that's going to be pain. Every time it moves, it's going to be pain. And it's going to be, and I can honestly tell you that, they rate child labor right at that most intense moment of it, a 10, right? And I used to tell my paramedic and my students, the best way to get your patient to understand that scale 1 through 10. 1 is just a little bit of pain, and 10 is me sawing your arm off with a rusty saw. So that most intense moment of childbirth, that's a 10. Some kidney stones, that's a 10. And you're like, what? But yeah, because you see back up here, look at that jaggedy, mean looking thing. That's coming and just ripping through. So what it ends up happening is people who have kidney stones, usually when we saw them in the emergency room and we picked them up as patients, we'd see 6'5" grown men, football player size, curled up in a little ball crying and, just rocking and because of the pain, because it was something that literally can just put you down. So please always, if you have a patient that comes in and they are complaining of that, or they have a history of that, be compassionate, be understanding that they're not exaggerating about that. Then that's one of the few times and of the few things that I will say reaches that level. Migraines can also reach that level. But most other things, I always, are you sure it's a 9? Are you sure it's an 8? When they give me that pain level. But these honestly can be, okay? And we don't want that. We don't want our patient to be in pain. We do not want our patient to have a blocked up uh, kidney to where we're backing up and causing toxins to build. We don't want kidney failure. So we have to do something, right? We have to get this stone
Excuse me, Miss
out.
Kim.
Yeah,
So that picture that you pulled up,
yeah.
I had to Google it myself because I was
Did
curious.
you?
Like, so it actually is someone's kidneys, and they are kidney stones, and it's because of energy drinks.
It's because
So
of what?
energy drinks. I guess that person drank a lot of energy drinks. So I was
Shut
actually reading the article.
up.
Yeah.
Oh, my, I was going to go look at this as soon as we were off.
Yeah.
Oh,
I was very curious because that's a lot. It can't, but yeah, it's real.
so they had to remove the kidney because of they
The
had
kid.
that many excess energy drinks. I'm surprised their heart didn't give out before
Mm-hmm.
that.
Mm-hmm.
Energy drinks are not good, guys. We'll try to we're gonna try to cover that with nutrition, but you want to avoid them. They are right when they were real big. I was still running 911 when they first popped up, the Monsters and the Red Bull. We saw a lot of arrhythmias because of people who were drinking them in excess. So, wow, I'm glad you
Yeah.
looked that up. I'm glad
Yeah.
you looked. Yeah,
Because
that's
that was gonna
crazy.
be my next question, like how many or can you have so many at one time? And then I saw that picture and I was like, yeah, I have to look this
Yes,
up.
yes, yes. No, now I have heard of people passing multiple multiple stones, but this I was almost like, no. Look at
Mhm.
the size of this one.
That's huge.
Yeah, so that tells, I mean, compared to a scalp, that tells me, yeah, it was bad enough they had to remove the entire kidney. I wonder
Mhm.
if the other kidney, wow, that's just, okay. I could talk about that all day. And now usually if that stone can make it through the ureter and you're strong enough to live through the pain, it gets to the bladder, you're good because it will pass from the urethra. I have very few cases, if I ever heard. And when that's the case, all they have to do is Foley them, where they put the tube in and extract it that way. So that's not as bad. Now, so let's talk about, look, I love this. What do you do with kidney stones? Lie down. Try not to cry. Cry a lot, because that's kidney stones. What are the signs? What are the very first few signs? First few signs is you're going to feel upper flank. Remember, when we're talking about the kidneys, we call that flank pain, and that's that upper portion of the back, right below, kind of at the level of the ribs to the sides, and are that retroperitoneal, right? And that perineum. That's one of the terms on that Quizlet I put for y'all. And some people feel it in their ribs. Some people feel it in a fluctuating, and that fluctuating it comes in waves. And that wave is basically how you're normally would be processing urine. Now, my husband how he would, how what happened with him is he was having a little bit of pain, thought maybe it was gas or something like that. Went to sleep. He woke up in the middle of the night, woke me up, and he was having lower right abdominal pain. And he said it was severe. So, what is the first thing you think I'm going to think it is? Y'all should know this. Lower right quadrant. What is there? I'm getting y'all thinking this morning. Your appendix got. Your
I was just
appendix.
about to say,
Ah!
yeah.
So
I had to put my hand and feel, okay, like where's what?
yes, yes. So the lower right quadrant is that's the first thing I thought. Okay, appendix. So I rushed him over to the urgent care, and they did a couple of scans, and they come back and they were like, "Dude, you have got an 8 millimeter kidney stone." And this place was like, "Okay, just go home. Here's some medicine. You'll pass it." And this is before I knew the circumference of your ureter. And I knew what they did. I just didn't know how big they were. So I went home and something just didn't seem right. My brother-in-law, being a doctor, I text messaged him and I said, hey Josh, we got a Michael here with a kidney stone, and the doc says it's an 8 millimeter, and sent him home to pass it and didn't give him any pain medicine. And the first thing he responds back as he text messages when we're still in Texas, he's not going to pass that. And Josh is one of the most smartest people I know. So I was like, okay. And so I take him to the hospital, like an actual hospital. And they were like, oh yeah, there's no way he can pass that. And so they ended up having to do surgery, which is another treatment, to remove the stone. So if it's left untreated, people can go septic. They can run fevers. They can stop producing urine. That's ayuria, right? Keep them terms. And this is just going over the type. Calcium, I told you most, and then uric, okay? And then this is some of the ways that they look and the percentage showing you calcium's most common. So what are the treatments, okay? So here we go. Now I know this. See, if I would have known the circumference, I would have looked at that doctor and gone, it's 8. The average 4 millimeter size has an 80% chance of passing, and then so forth. It just decreases and decreases, and I would have probably smacked the doctor around. But now I know. So the just 4 millimeters has an 80%, while 5 millimeters drops all the way to 20. 6 millimeters, you got maybe 5 to 10%. So you see where we're talking, because that 6 millimeters is the average size of the ureter, okay? But if they say it is small, what they're going to tell you to do is drink lots of water. And they're probably going to give you some medicines to help loosen and relax the muscles around the urinary system, and probably some mild pain medicine. And if it's a bunch of stones, or if it's a one that they feel that is large and that they can treat without opening you up, there's a treatment. Do you see the word lith? It's called lithotripsy. And basically, there's several ways that lithotripsy can be achieved. But they're basic, they use sound waves. And one of the ways that I'm familiar with is they put you in like a large tub, and it's full of water. And they direct sound waves at the stone, and it busts it up into like a bunch of tiny little pieces that make it much easier for you to pass. And so that's called lithotripsy. This another way, if it's just so large, like golf ball size or something like that, they may have to do what's called a tunnel surgery, where they flip you over and go in through your back and remove it. and that we don't want, but that sometimes happens. And then they have what my husband had. He had what's called a ureteroscopy, and it sounds like it's a pretty easy thing, but I'll give you the rundown for him. Like for him, he was sedated, and they put him under, and they went in with a little probe that has a light on it, and it also has like a little laser in a basket. So it's a kind of neat machine, and they put it up in there, and I'm going to show you a video. It's pretty cool. They put it up in there, and they find the little kidney stone, and they zap it, and they get it small enough, and then this little basket comes out and collects it, and then they pull everything out. Now, this all went up through his urethra, and it comes out through the urethra. So then they told me they put a little stent. And, I'm thinking like a little tiny wire meshy stent, like they put. And I was like, okay. And they're like, well, he might pee some blood for a day or two, but he'll be okay. And I was like, okay. So we went home and we took his medicines and everything. And a week later, he's still peeing blood. So I called and I was like, he's still peeing. They're like, oh, that happens sometimes because of the stent. Well, 2-3 weeks later, after the swelling goes down, is why they put a stent in. And after the swelling goes down, they're like, it's time to come have the stent taken out. We do it in the doctor's office. Michael's on the table. There's an assistant and the doctor, and there's a little TV camera, another scope, and she takes this camera thing and sticks it in his penis, goes up through it, finds this stent, hooks onto it, and then pulls it out. I kid you not, that stent was this long, and it was the size of a little bigger than a wire coat hanger, and it was white and like kind of like a bendy plastic, and then it had a loop on the end of it. When she pulled that out, I about died. Well, the trauma, throughout the trauma, Michael doesn't remember anything. He didn't pass out. He did really well, but he does not remember that. I could not believe that had been in him the whole time. I was like, when you said stent, I thought you meant like a. She's like, no, we have to keep it open. So be understanding, and if your patient does, if you do work with a urologist or a nephrologist, that's something you can be familiar with, is that stent, yeah, there might still be bleeding, but the patient should always call and check with the doc and that kind of thing. There are medications, like I said, to relax the bladder and different things like that that they can give. Now, the good news is if it's a calcium stone, when they do that sample, they take that part of that stone with them. And sometimes with patients, if what they'll have them do is, if they know they can pass it, they'll give them a little, it looks like a strainer, and you have to pee through the strainer, and you catch your stones, and you send them, and they check them to find out what they are. So what that does is that lets the doctor decide, okay, it's calcium, so this might be wrong. So for Michael's case, it was vitamin D. Other people, like say if it was uric acid, so okay, well, you have a buildup of that, so they can put you on a medicine, the same medicine that they use for gout. It's called alpurinol, and it can help prevent any more of those. Diuretics, which we all know what that does, that helps you urinate, and other medications just to ease the process and send it along its way. All right, any questions about kidney stones now that we've had a fun and exciting adventure through them? All right, well, I'm going to keep going. The next thing we're going to talk about is called PKD, and it's polycystic kidney disease. And I'd like to show you the picture of it. So this is what we see with a patient who suffers from polycystic. Now, we know a cyst is just a fluid-filled sac, but if you've ever had an ovarian cyst or any other type of cyst, it can be painful. So you could imagine what somebody who had this all over their kidneys And this is something I want you to remember about it. It is inherited. So that means it's genetic. Okay. So there usually it's something they can find out soon. There are treatments, but there's no type of cure. Because of that, these patients usually live a lifetime of extreme complications with their urinary system. They live a lot of problems with high blood pressure because I told you, blood pressure and kidneys, they go hand in hand. And they usually don't have the same life expectancy as a regular person because of kidney failure. Now, dialysis is an option, but transplants are not. And the reason that a transplant is not is because of this right here. It's genetic. So even if they put another donor kidney, it still has the same possibilities of developing this disease again. The symptoms, like I said, pain, high blood pressure, constant urinary issues, and remember ascites, where the stomach swells, so increase in the abdomen swelling, lots of, like I said, lots of infections and urinary troubles. And the main thing is just treating the patient and dealing with complications along the way. The next thing we're going to talk about is pyelonephritis. Now, on Quizlet, I really want y'all to look at that Quizlet. I made that just for y'all. And that this is one of your terms, pie. All right, so when we think about that, that's talking about a specific portion of the kidney. All right, but when we think of pyelonephritis, the nephrons, right, itis, right, inflammation. So this can occur because of a UTI. This can be something that's a viral infection. Sometimes it's because a patient had a catheter that got infected. Sometimes it can just happen. And the symptoms with pyelonephritis depends on the person, but usually it's a high fever, vomiting, pain, chills, nausea, frequent feeling to urinate. And what this is you have an infection in the kidney. All right. So, and you have inflammation and infection in the kidney. Okay. Pyelonephritis. And what is the treatment? Usually the treatment is going to be, if it's just an infection from a UTI or something like that, it's going to be antibiotics. Now, if it's an underlying medical condition due to something else, that would be treated separately. Does that make sense? All right. And we're going to go ahead. We're going to talk about renal failure. Now, I did post that video, and I saw that some of y'all watched it and commented on it about dialysis. And that video does an amazing job about explaining what is dialysis, what processes the patient goes through, and how there's the different kind, the hemodialysis and the peritoneal dialysis. But usually a patient is placed on dialysis because of renal failure. And there are two kinds. Now we know anything that is acute means it's what? I am ready. What is acute? Acute means it develops. Okay, don't leave me hanging. That's like a high five in midair with nothing. Acute means it develops rapidly, very sudden. It's not a long-term illness like chronic. Remember, acute is when could be renal failure, could be from something like car wreck. massive trauma or some type of sepsis of the body or some type of other infection that develops. But it's something that usually comes on very quick, and the person is usually extremely ill, okay? And they may need dialysis temporary, maybe it's from a car wreck, have time for their body to heal and everything. And other
Yeah, it's
times,
fine.
and then other times, they'll get the infection wherever it is, maybe it's someplace else in the body under control, and they're able to remove the patient and reverse the dialysis. Signs and symptoms of somebody who has an acute uh, uh, kidneys that are shutting down would be decreased urine output, swelling and fluid retention in the limbs, drowsiness, shortness of breath, seizures, coma, chest pain. So really serious symptoms here, guys. What is the treatment? Well, the treatment, like I said, usually is going to be dialysis. Sometimes it could be medication, right? But if the kidneys aren't working because of acute renal failure, dialysis are needed to remove the toxins, to filter and clean the blood artificially. And that's what this is. This is why I posted that video, okay? So I wanted you to be familiar with it. And the video talked about hemodialysis, right? Where they take the patient's blood, it's sent through the filters, it's cleaned, it does the job. This is a large kidney, and then it's put back in. Now, we do have modern machines that are actually wearable, that people can walk around and do normal daily things and not be stuck at a center for the entire day. But anybody that has hemodialysis will need a shunt, and that's what I think Fisher is what I can't remember what they called it, but the video explains that and talks about how they do a little surgery to make it so that there's a port for easy access for the hemodialysis. And then the other type of dialysis is the peritoneal. And it's basically you have a surgical incision, and it's dialysis solution is filled up, and then everything is drained, and it does it via the peritoneal area. So this is, I would say, a lot more common than this, but some in the past people preferred this because it could be something done at home. But nowadays, with the way that they've come up with the machine and the technology, a lot of people are choosing for, the hemodialysis, where they can actually, like I said, it's portable. And then we're going to stop. We're not going to go into chronic or long term. But if you have not watched that video about the dialysis, I want you to, okay? Because it really helps explain this. And like I said, I'm going to post the video about the Constitution Day. Let me get a list of download who was here today. And besides that, y'all have a wonderful day. And I will talk to y'all tomorrow. If you haven't done your sword baby monkey, get it in. Bye, guys.
Bye, Miss Gav.
Bye.